You're listening to 419 Education and Training Need to Connect podcast. Hello, everyone, and welcome to another episode of Need to Connect podcast. I'm your host, Devonna Willis, the founder and CEO of the Black Massage Therapist. And today on the podcast, we have Sakinah Irizarry, and she will be speaking on maternal health in our industry. So before we get to that, everyone, please like, subscribe, and share this podcast, whether it's on YouTube, Apple, Amazon, Spotify, wherever you see and hear. Please share, like, and subscribe. So now we're going to talk to Sakinah. Hey, Sakinah.
Hi, Devonna. How are you?
I'm doing good. How are you this morning?
Lovely. It's a beautiful Sunday. It's a beautiful sunny morning.
Sunny morning. And you are in where?
I am in Saugerties, New York. It is upstate New York along the Hudson, about smack between New York City and Albany,
Got it.
the state
Cold.
capital.
Cold.
Yeah, pretty cold most of the time, but today is in the 50s and the sun is out and the flowers are popping. So it
Oh,
feels really good to have spring. We get a lot of false starts, but it feels really good to have spring finally arrive here.
amen. Amen. So what we're going to start with is just your background. So introducing yourself to everyone, how long you've been a therapist, what school you went to, and why you chose the topic that you will be teaching on and why you chose that topic.
Okay. So my name's Sakinah Irizarry. I have been a licensed massage therapist since 2003 in the state of New Jersey, since 2007 in the state of New York, because my education as it is, because there was at the time, and still is, no reciprocity between New Jersey and New York. My education in New Jersey did not count towards getting my license in New York State when I moved here.
Still to
So
this
I had
day?
to, still to this day, New York State is very unique in its education system. It does not have a formal system of reciprocity between for hours. And at the time when I moved to New York State in 2004, the state actually gave some nod to honoring some of my hours, but there was no way to get a school to honor that when they could get a full tuition. So I went
Uh,
back to school a second time for a degree program.
mm-hmm.
The original program I went to in New Jersey was a small school called Healing Hands in Westwood, New Jersey. When I came to New York, I went to Columbia Green Community College and received an associate's degree, applied science. And I'm actually do not feel like that was wasted time. It was
Okay.
an excellent use of time to hone my education and introduce me to a whole new group of people in an area where I was new to. So I've been doing this for over 20 years. This
Oh,
particular
wait, before
subject
you get to
matter.
your topic, really quick,
Oh,
I wanted to
mhm.
share with everyone, just so you know, New York, New Jersey, and Connecticut is called the tri-state area. So they're literally just connected by bridges and it's very easy to go to. So if you've ever been to New York City, you can take bridges to go to any, well, you don't need a bridge to go to Connecticut. All that's to
No,
say is for there not to be reciprocity from New Jersey to New York, to me sounds a little crazy. That was it. That's why I say still to this day, but
a little bit. A little bit, and there's debate going back and forth about the massage compact that
Right.
ABMP is working with. New York State's education requirements are twice that of many of its surrounding states. And there is a lot of conversation going back and
Right.
forth. I won't
No, we're
say
not
what
going to get
side of
into
that
that. Yep.
we're not going to get into all that today, but there are groups who have taken position on that, and I am well into my career, so I'm going to leave that to the folks who are
Exactly. I agree.
getting into it. But as for the subject of Black maternal health, this came of a lot of reading and a lot of, watching a lot of the conversations around massage therapy talk about wanting to be respected in its field
Right.
as the medical profession, as part of the medical profession.
Absolutely.
I actually I'm actually a member of an organization that you have spoken for, the New York State Society of Medical Massage Therapists. So there's lots of conversation always talking about, medical massage. We want to be respected as healthcare practitioners.
Right.
So I start looking at areas of healthcare, and we are well aware of the disparities in healthcare that Black people generally across the board in the United States seem to be at the bottom of all of those healthcare disparities.
Yes.
So I'm thinking, why do we want to mimic what's happening? Why do we want to repeat the mistakes that are happening in healthcare in our industry? That doesn't make sense to me.
Correct.
The statistic that gets cited many times and jumped out, that Black women are 3 to 4 times more likely to die in childbirth, during pregnancy and childbirth, and in the year postnatally, than their white counterparts. That jumped out to me. Also, part of what I omitted in talking about my education, since 2007, I've been a prenatal massage therapist.
Right.
And also practiced as a doula.
That's what I was waiting for you to say, Ms.
Yes.
Doula.
So that's kind of been my specialty with massage therapy, was been a doula and prenatal massage. So it was very relevant to me, especially seeing these statistics climb since I had my children.
Okay.
These statistics get worse and worse.
And let's pause for a second. So we're in 2025. We have new technology coming out every day. We are in the years of AI, and to see that the statistics of this going up instead of decreasing is very worrisome, because it doesn't logically make any sense when we have the technology and the know-withal to know signs and symptoms of when things are going awry, especially amongst Black women that's pregnant. Correct?
right. One would think that the technology has gotten better.
Right.
But the thing that I think has not gotten better, and it is in part my hesitance to jump with both feet into technology solutions, is we're not listening to Black women.
Well,
The medical field does not have a great history of listening to women at all,
okay.
to begin with. And then listening to Black women, even less so. And listening to what their experiences are like, and listening to what their experience of their lives, their health, the factors that might feed into their health, what are called by health organizations the social determinants of health.
Right.
All of these things, and the fact that a medical appointment, an appointment to talk to your doctor or midwife, can be abbreviated down to like a 10 or 15-minute appointment when you're coming in for a checkup. And that is not enough time to build a real trust relationship. there's a lot there in healthcare where healthcare as it is practiced is falling short.
Right. Hello, thanks for watching. Please like, subscribe, and share our 419 Education and Training Need to Connect podcast. And so my question is, so how does this relate to the massage industry and how this is going to be tied into the ethics class that you will be teaching at the conference this year? By the way, October 6th and 7th in Charlotte, North Carolina. That's a Tuesday, Wednesday. All right.
Yes. So how it ties in is when I looked at some of the top, health pregnancy complications, when you look at some of the most common pregnancy complications that are happening, the research shows them as, well, first of all, it will say that one of the risk factors is being Black. And we know that that is not biologically.
They said the risk factor for being pregnant is being Black?
No, the risk factor for pregnancy complications, for certain pregnancy complications, the risk factor is being Black. That if you have that we have this pregnancy complication, preeclampsia, what's the risk factor for it? Number one, being Black. Being a Black person is a risk factor for preeclampsia. And how that is getting conveyed to the healthcare industry, and this is where it ties into the ethics for me, is how that's being conveyed to healthcare is, well, we can't do anything about that. We can't do anything about that. You're a Black woman. This condition, this pregnancy complication has happened to you, and it's happened to you because you're a Black person. Rather than backing up and looking at those social determinants of health, looking at what, they will look at a health history. Someone would look at a health history, but they will not discuss or talk about what your experiences are like. And this is, again, how standard healthcare treats Black women in pregnancy. With massage therapy, we spend a lot more time in an appointment with our client or patient. We spend a lot more time with them. We talk a lot more than they get to talk with their healthcare provider about their experience, about what they're going through. I feel, especially in bringing this conversation to the Black Massage Therapy Conference, that it opens up the door to talk more about where massage therapy can go in terms of research with Black massage therapists.
Right.
Being the care providers, providing care to our patients, where we can talk more about, we spend more time, we build a more trusting relationship. I think we've all had that experience as massage therapists where sometimes people will reach out to us about health stuff that has nothing to do with massage.
Right, because it's like, did you talk to your doctor about these issues? And they're like,
exactly.
Oh, I don't know. I'm so nervous. I never know what to say. And I'm like, the same questions that you're asking me, these are the questions that you need to be asking the medical doctor that prescribes you this medication, that medication, right? Or write it down, right? I tell them write it down so you don't have to be scared.
But part of the reason why people do that is because they have a trusted relationship with their massage therapist.
Correct.
Who they see more regularly for an hour to an hour and a half to whatever period of time. They have a more trusting relationship, and therefore, since they trust you, they come to you first as a care provider. We refer them in the right direction, but I want to see that trusted relationship utilized to come up with the research. Now, there's some research that exists out there, but not nearly enough about how massage therapy can relieve anxiety, how massage therapy during labor can relieve anxiety,
Right.
bring down blood pressure. It seems to me, especially being many of those pregnancy complications,
Mm-hmm.
the number two thing on that list is stress.
Oh, for
You
sure.
know, what are we doing?
Right. Right.
Right? It seems to me a very obvious and it fit for massage therapy. There is nothing that we're going to do to stop what's happening in the medical industry. That is their
Exactly.
field to handle. That is their field to handle. But I feel that especially with the rollback of being able to say certain words
Yes.
and wrestle with certain concepts in, in this current environment we are living in.
Girl, the words. I'm like, how you gonna tell somebody not to say? What happened to the freedom of speech?
Well, we do not speak what we don't want to know.
Lord.
So
Okay,
if we don't want it,
question on
yes.
this, because you mentioned something, and I'm like, how many, or do you know the percentage of prenatal or even postnatal massage therapists that are actually in the room with the client when they're giving birth doing the massages?
I,
Because you were saying massage, while during the birthing process, or a massage therapist that educated the significant other, or maybe even a doula, providing those massages and relaxation techniques during the
during
birthing.
labor,
Yeah, during the labor. Yes. So what's,
during
the
active labor.
percentage?
I don't have a percentage for that. I do not know that has been tracked how often a massage therapist has been in the room for, how many massage therapists are attending in the room. And then that would also, have to get broken down between how many doulas, how many partners who have been trained in, some basic massage therapy, support therapies. I think they may have that information when it comes to doulas, how many doulas are that industry, how many doulas are in attendance in active labor births. Studies have shown having a doula attend your birth, midwife attended birth, that these lower risk factors, and that's all during active labor. Specifically, what I'm talking about for an active labor massage, absolutely great. I advocate for it. But I'm talking about during the pregnancy, the journey of
Okay.
pregnancy,
Okay.
where many of these conditions, these pregnancy complications, can crop up before or up to a year after pregnancy. And here's the thing about those statistics. These have been cited by the CDC as preventable.
Of course it
That these
is.
deaths from these complications are preventable. And so many of them are driven by stress. So again, it's just during that pregnancy journey, after and afterwards, wouldn't it be great to have more massage therapists trained to know what the pregnancy complications are, what the signs and symptoms are? They're seeing their patients more regularly. We're not going to be able to diagnose,
No, no, for
but
sure.
we are, just like that conversation, that pretend conversation we had when, our client calls us up and it's like, oh, I'm having this symptom. And you're like, you should call your doctor. You
Right.
should write this down. Your medical provider who is aware of all of these things. We can help them advocate.
So let me ask you a question. Okay,
Mhm.
so two things that came up in my mind while you were speaking. Number one, this seems like there needs to be more research, and we have the Massage Therapy Foundation, right? And so
Yes.
I don't know personally if that's been done, but if it has not been done, that is an opportunity. And I've been speaking to the Massage Therapy Foundation. They supported the conference the last 2 years. This is something that we need to get in front of, and because there are
Yes.
grants being given now for different topics, and this is something that we can probably look into, right? So that's number one. That was a thought that came in. The
Hmm.
other thought that came in while you were saying this is, I know I see it a lot, especially in the Black Facebook group that we have, and our secret Facebook group,
Hmm.
is there's a debate that women should not get prenatal massage in the first trimester. What are your thoughts?
So, having been a prenatal massage therapist since 2007, I do massage in the first trimester, especially with my clients whom I've had a trusted relationship
Yes.
for a time. It wouldn't be my option to have somebody walk in and this be the first, in their first trimester, and I've never met them before,
Okay.
but for people whom I've had a therapeutic relationship with, I absolutely massage in the first trimester. There is nothing indicating this. For me, to me, the don't massage in the first trimester is a legal maneuver and not connected with
Mm.
data. It's not connected with data. Most
What's the
most
legal?
miscarriages.
Yeah, let's talk about that.
The, the legal part of it is that most miscarriages happen in the first trimester.
Right.
And so if I have, and I'll be very open about this, I had a miscarriage in
Right.
my first pregnancy. You're searching for what are the reasons? What are the reasons? Why did this happen? This wanted pregnancy, and I thought I did everything right. Miscarriage happens for many reasons,
Yes.
and many of them under none of our control. But because we live in a litigious society,
Okay.
many people will say, oh, I can't receive massage in the first trimester because it might, somebody might press on that point on my ankle
Right.
and it will cause a miscarriage.
Not if
And
they're
that,
educated.
not if
Okay.
they're educated, one, and it hasn't been proven by data that that can happen.
Okay. Okay. Well, thank you for clearing that
So,
up. As the professional and expert that you are, I wanted to bring that up. So we're going to
right.
shift gears a little bit. Okay. So we are talking about the Black Massage Therapist Conference. You
Yes.
attended the very first one. We made history together, right?
That was
Yay.
wonderful. That was
That was the
wonderful.
first time we met in person because
Yes.
we became friends on Facebook.
In 2020, when you started the Facebook group. Yes.
Right? And so to see it come to pass, what was your thoughts?
It's very interesting how I try to convey this, and really among us, I feel like there was just this understanding that we'd never had this happen before.
Right.
We've never had this happen before. All of us come into the room and all of us understanding, shared experience, shared background, we come from all different parts of the country. I remember like the very first person I met upon arriving, because, silly me, I didn't stay at the hotel the night up, I won't make that mistake this time. But when I arrived the first morning of the conference, and the very first Black massage therapist I meet and sit down with and have breakfast with is from Alaska.
Isn't that amazing?
It is. It was just such a wonderful and warm experience. We talk about like that Langston Hughes poem about we wear the mask,
Yes.
and not having to have any of that.
That was the first poem I learned in school. Okay, so coming from the Bronx, so I did go to a predominantly Black school.
And I grew up in the Bronx for a minute, and then my parents took me over to Jersey. So,
You
but
shipped
still,
out. So, but that
shipped
was,
up to Jersey.
yeah, I remember we wear the mask that grins and lies, that hide our something and shades our eyes. Anyway,
Yes.
but yes, it's very true.
But the fact that the mental load of not having to carry that
Amen.
was something that you don't realize that you carry until you put it down. I wish I could have it meant so much in that moment. And I'm so grateful to you from Facebook to a conference with, it was amazing seeing people who I'd interacted with in the community,
Right.
seeing different leaders in the massage industry. I unfortunately missed last year's where Benny was in person. Benny Vaughn was in person,
Yes.
but having him call it was everything. It really
Amen.
was.
Amen. So we're excited to have you attend this year and as a expert and as an instructor. I think we're still working on the itinerary, but I think for you, because you are teaching our ethics class, this year we're going to probably have ethics 2 days. And I made a mistake, you guys. It's October 7th and 8th. Sorry, not 6th. So 7 and 8th, but that's because I'm arriving early. So we're
Uh,
in the middle of planning, so we're gonna be there from like the 5th. So yeah, so we're excited about that. We're excited about what you're gonna be presenting and also meeting new people. And
yes.
tell us, because we've been doing a survey to find out what's going on out there for those who are attending, why they're attending, for those who haven't attended. And so far in the survey that's been coming up is, us and what we struggle with is the socioeconomic factor. And that's why I do have, again, this year, a financial literacy.
Hmm.
This conference, I've been to many. This conference is the only conference that allows and have payment plans. Because a lot of conferences, and I'm sure you've been to some as well, you just
Oh
got to
no,
pay up
it's a
front.
lump sum.
Is
Yeah,
is a lump sum. And
it's a lump sum.
so,
You might get some discount for paying really early.
right, the
And how many
tiers,
of us can,
right.
yeah, and how many of us can part with a chunk of money like that, months and months and months in advance of the financial literacy? I advocate heavily for it. I work with a financial planner. I worked with someone to help me with just the budgeting of my business, just the day to day, month to month budgeting of my business. And when I tell you what a relief that was on my mind, and how it allowed me even to pay myself more in my business
Okay.
to the point where I just hired another employee. Financial literacy is essential, and we've got to treat this with the seriousness of a job and not a hobby, not
Uh,
something for an extra change in our pocket. But generally, overall, the massage industry, it's suffering from, that. I won't say from the people, I'll just say from, just the general vibe in the industry is that this is something that you do on the side and you have enough disposable income to go take a class in Costa Rica, right?
right.
So
Right.
with that kind of a vibe, it has not, I don't think, attracted enough of a focus on this is a business. This is, rather than anyone who's trying to sell you on, like this one technique is going to make you thousands of dollars.
Right.
So just the day to day, you can tighten up things. You can start to track things in such a way that it just becomes such a relief once you realize what the benefit that managing your money and managing it well
Yeah.
does.
Amen. And professional development, right? And so, once again, with the budgeting, you have to budget. More and more states, thank God, and as a CE provider, is requiring CEs every 2 years. And so that's something that should be a line item, just like your renewal for your insurance, and that it always should be a line item. And as we continue with the conference, we'll definitely make those modifications with having payment plans, whether it's the monthly or through Afterpay or the other ones, Klarna or whatever the case may be, because I understand, but I also want you to be able to get the benefits of what we offer here at the conference between networking and, with this conference, we're also providing food. A lot of conferences, they don't provide
Yeah.
food, right? And so, knowing we're in this intimate setting for 2 days, maybe three, depending on if you come the day early for the registration in the morning, in the afternoon. So yeah, so it's really important for that and to set some, budgets aside for that as well. So one more question before we go. Educational resources. Is there any specific resource or books or podcasts that you think people should start reading, looking into? Tell us, just give us some advice on that.
I'm actually just pulling it up because I want to make sure I pronounce her name correctly. The very best book, I would say, and I think it is essential to understand, it will be a part of what I'm teaching in this class, is it's important to also understand history.
Yes.
It's so essential to understand history. And there are also lessons to be learned about healthcare and disparities and ethics with regards to Black bodies. The book that I think is the best, the smoothest storytelling that gels it all together is a book called Legacy by Dr. Uche Blackstock.
Spell it. What?
Um,
Spell the last name.
Blackstock, I believe, Blackstock.
SEOCK.
ST.
Oh, Black Stock.
Blackstock.
Got you. What's the first name again?
Uche. UCHE.
UCHE. And what is this book about?
Uche Blackstock is an American emergency physician. She was an associate professor at New York University School of Medicine,
Okay.
and she's founded a company called Advancing Health Equity. And she wrote this book called Legacy about how her mother was a doctor. She and her twin sister are doctors. Her mother's experience, her experience in healthcare,
Okay.
and interwoven in her personal story. It's a memoir, definitely, but interspersed in that story is history, is our statistics, our current practices, are the observations of attitudes, from the people who control healthcare,
Right.
from the people who are teaching healthcare.
Mm-hmm.
All of that is in her story. And I really advise, I'm a big fan of audiobooks.
Okay.
I'm a bigger fan of audiobooks that are read by the author.
Yes.
And she's the reader of her own
Okay.
book. I can't recommend it enough.
Okay.
It is so many lessons in there. There's her own maternal health journey.
Okay.
It explains a lot. It pulls a lot of what we're dealing with together, especially, and I can't stress enough, as we are seeing in our current environment shut down conversations, we are all in our different segments of healthcare
Yes.
going to need to step up.
I
Like
agree. I agree. I agree.
We've got us.
Amen. We got us. So it's my goal to actually have Audible, and I've been listening to it a lot more. And so what I'm going to do is add this to my Audible list to see some of the other books that you would talk. So Legacy, is there one more that I should look into, or that's just the major one I should be looking into? Because I'm going to put it on my list right now before I forget.
So that is one. I'm actually pulling up my Audible, looking for some of the books and podcasts that I've listened to. One that I will recommend that is more of a general health podcast that I think that, and they're not massage specific. They're healthcare general, but I again think that they are essential learning for all of us.
Okay.
One of the podcasts that I listen to fairly regularly is called Public Health on Call.
Mm-hmm.
And it's by the Johns Hopkins Bloomberg School of Public Health.
Okay.
We are all, again, in this environment, going to need good information from public health about just our lives in general. But they have had essential podcasts on maternal health, Black maternal health. They had a 3-part series on how when you walk into any medical facility, one of the first things they do is clip that little pulse oximeter onto your finger.
About that.
And how they have known for decades that these are not accurate in the case of darker pigmented skin. They've known for decades that they are not as accurate in darker pigmented skin. And yet, this is something that sets the standard of care when you walk into a medical facility. They
Right.
had an excellent 3-part series just on that and the struggle to get to a new standard. That on its own. They talk about, you know, also, I don't listen to every one of them, but I listen to many of them. And again, I think we're going to have to start really using our discernment
Amen.
to filter out a lot of the junk and listen to good messages around health, good and useful and actionable messages around health. Also on Instagram, Joel Burvell has for years, he's called the Medical Mythbuster, has
Okay.
been talking about health disparities for, quite a few years now.
Okay.
So that's always a good follow
Yeah.
as well. As I come up with more, there's more that I have to recommend that I will be in the class.
Yes.
Because you can't know too much. We have known too little for too long.
Amen.
Understanding some of the history of how we got here, we have to understand that healthcare, particularly maternal healthcare, was built on the brutality of Black women's bodies that carries through to today. And having that education really informs our choices in what we might want to specialize in, our choices in how we care for our clients and patients and our own families and ourselves.
Well, thank you so much, Sakinah. This was a lot of wealthy information, and I hope you guys take a chance to look at some of the resources. Also, attend her ethics class at the conference. It sounds like we may have some doulas some massage therapists that may also add doulas to their names because of the information that you've given us and the enlightenment. So I want to say thank you so much for coming on today on the podcast. Also, everyone, please go and register if you haven't registered for the conference. Go to www.blackmassagetherapist.com. Hit registration. We have tier pricing. So check out where we're at in our pricing. And also, look at the hotel. You could book the hotel on the website as well. You have discounted pricing for the hotel. We're also starting to do grants for businesses. So fill out the application if you want a grant, as well as a student grant. So we have some great things going on. Also supporting all of our sponsors. We have AMTA, they are our premier sponsor, and so they're supporting us. So once again, thank you so much, and I look forward to seeing you guys next episode. Like, subscribe, and share. See you later. Bye.
Thank you.
Hello, please like, share, and subscribe. And don't forget, check out our next podcast episode. See you later. Bye.